Hey guys, my name is Brad Norris. I'm an RMT and exercise physiologist and kinesiologist. I work kind of north of Toronto, but I'm really excited about the upcoming Canadian Massage Conference. I'll be teaching a session on kinesiology tape and building kinesiology tape into your practice, really kind of demystifying how to utilize it to complement what you do as a massage therapist. And then my second session will be on floss application using compression floss bands as an adjunct tool for what you do as a therapist. So I teach over the course of the 4 days. I'll be doing demos and I'm looking forward to the conference and I hope to see you there.
Hello, my name is Lindsay Geiger. I'm a registered massage therapist, a certified sports nutritionist, and a personal trainer. I am so excited to be a speaker at this conference. I am going to be talking about needing balanced service in sports and how you really blend your profession as well as sports world together. So I'm so excited for you guys to join us, and I can't wait to meet all the new people.
Hey guys, what we want to do today is kind of talk about some of the principles that guide our practice, and we'll give you our background so you understand a little about what we do and what our kind of perspectives are on training and treatment. And I think they'll be very close in the context of what we do. My name is Brad Norris. I have been with Rock Tape for approximately 10 years. I've been in the sport performance world for almost 35 years. So I've trained and worked with NFL players and NHL players my entire career. I currently work with the bobsled team. I was on the Canadian track and field and Canadian bobsled team for years. And now I've shifted into a role where I serve more as kind of a strength and conditioning guy and a massage therapist and sports medicine person. So my practice is very much based in that performance world. But what we want to do today is kind of talk a little bit about that, because I think people think if you're an athletic therapist, you deal only with athletes and you're really confined to that. And that's really not the case. So my practice is very multidisciplinary in its perspective. I'm ART certified, a fascial stretch. I have a sport acupuncture background, and I'm an RMT and kinesiologist. So I kind of hit all ends of the spectrum from performance to injury. And I'm assuming that Lindsay will have the same perspective on that. So I'll let her introduce herself. And then what we want to do is just have a discussion about really what guides our practice. What do we do as therapists that is unique, potentially? And then what's kind of consistent across all of those platforms. So.
Yeah, absolutely. I'm happy to be on this phone call. This is so exciting. Cool. Well, my name is Lindsay Geiger. I'm a registered massage therapist. I'm a certified sports nutritionist. I'm also a personal trainer as well. So it's a nice little trifecta of what I've really created in my business. I'm almost fully certified as a sports massage therapist as well. I have a couple certification exams to do and then I'll be fully done, which is exciting. But I've been in the field for 8 years and I've been luckily able to travel the world with all different sports. Currently, I work with a few private NBA players and NHL players, which is always fun. And, just like you, I'm always open to kind of mixing and blending different modalities as well as experience. So I've really tried to evolve in fascial stretch therapy, taping, so kinesiology taping. I would love to get into rock tape.
Awesome.
Neurostim stuff, all that stuff is really my forte. So we actually do have a lot in common. It's wonderful.
Yeah. So this is the first time we've met, but I know of you, and obviously I think we're going to have some synergy about how we do things, because did you come from a strength and conditioning background, like a more of a sport performance background before massage therapy?
Yeah, I've always been an athlete my whole life. So I played hockey my entire life, as well as ringette before it switched all into hockey. Right. But yeah, I have a huge strength and conditioning kind of background. I always knew that more of like the sports rehabilitation was something I really wanted to focus on and evolve in, just because I've been in those shoes of athletes and understood the importance of rehab versus just the actual sport itself. So yeah, it is pretty cool.
So I have to say that was my motivation when I left bobsledding, and this is not to in any way be critical of the people that were there. We had wonderful therapists, but it was the 80s. So I'm quite a bit older, and it was the 80s when I was on the team. But the reality was that there were just gaps. I didn't feel that we really solved a lot of the problems from a training perspective or a treatment perspective in a way that I think my career could have been longer. And I had a ton of concussions, and I'm still treated for concussions. I still get work done all the time. the point is that I really thought when I left, there's got to be a different way to do this. There has to be a different perspective on both training, performance, and injury. And how do we kind of like meet in the middle?
Big time. Yes.
We didn't do it, Lindsay. We didn't really do a great job with that. And it again, not a critical kind of analysis of anybody. Our therapists were fantastic, but they knew what they knew.
Then that was a different era too of science, right? Science.
Yeah. Like when you agree, can you imagine? Like I think about it this way: if I was an athlete, knowing what I know now and having these resources when I was an athlete 30 years ago. Oh my gosh, it would have been like a totally different experience for me.
Yeah.
So that kind of has grounded me in how I kind of perceive what's going on with athletes. And I love dealing with athletes because there's so many other things that you really have to consider when you start looking at performance versus dealing with a client who has, let's say, some low back pain. I still approach with the perspective that I want to get them to move more efficiently, but athletes do present a bit of a challenge. So here's a question. What's the biggest challenge you see with athletes when you're treating them, specifically high performance people?
Oh, well, we can talk about age first and foremost, because that is something that is not discussed enough, is that for myself, I treat all ages of athletes. There isn't really a specific age that I focus on. And if we have, the youth with injuries, like that's a tricky one as well, and how to kind of work on them at the clinic as well as on sideline, because those treatments are also different. And comparing the age of athletes, I think that is the true struggle, is that there's a lot of issues that are happening, say for the 80s, for example, and you talk about surgeries, you talk about, how they used to, return to play. But that actually is what is more of the focus of what athletes I'm working on right now, is, I'm sure you've seen them, the massive knee surgery scars, like the pretty much the open surgeries that they used to do versus the small incisions. And so right now, I think I'm just trying to better understand the different eras of science and how it's actually progressed over time. And that's the struggle I find, just kind of trying to find that balance with athletes, depending on the age and depending on the injuries. But do you have a common injury that you see most common with the bobsledding or anyone specific?
So I deal with a lot of rugby players. So I just had some pro guys back from France, and I deal with rugby locally. And we, surprisingly enough, where I'm from in Lindsay, rugby's a huge thing, and we've put tons of guys into the national program. I've trained a ton of them.
Oh, right on.
All of these really kind of amazing people come out of this small community. So I see tons of rugby issues, but my biggest challenge with athletes is trying to get them to dial it down. I don't know if that's what you see, but the idea that more is better.
Yeah.
More, and even in treatment, their expectations are such that it's all, and I've really changed my practice in the last few years. I've become more osteopathic in my presentation. I'm very good at dealing with things in a much softer manner. When I learned ART, I taught for Charles Poliquin for years.
Okay.
When I learned ART and those strategies, it was like painful. And people would leave and they'd be like, wow, that was really intense. That wasn't good though.
Yes.
It's in hindsight, I don't see that as a positive. So I think with my practice, it's changed a lot because I've learned so much more about how to tap into the nervous system and do things in a very subtle way to get a great effect. Athletes aren't always responsive to that, because most athletes are I had just a rugby player in France, and he's like, go hard, in deeper. And I was like, but I don't need to though. I'm getting the type of tissue length and tissue response that I want without having to go my body weight into you. And so for me, not only has it been an eye-opener in the context of me being better at my practice, I'm not beating myself up to do it, but more importantly, my athletes are now kind of buying in. They're starting to really understand that there's a different way to approach an injury, and we don't have to be throwing everything at it to get an effect. I use this all the time when I teach for rock tape. No one's ever fixed a Ferrari with a sledgehammer. So you can't, like you can't, you know
That's
what
a
I
good way
mean?
to say it.
No, but
Yes,
you
actually.
can't beat a result into somebody by just doing more stuff. And I
Yes.
think that's the slippery slope as therapists we get on, because you think there's all this stuff out there and I want to do everything. I think you have to be more, I don't know about you, but I think with, especially with athletes, a lot more strategic, because you have a very limited amount of time to have an effect. So
Mm-hmm.
that, I mean, I don't know how you feel about it, but that's really the struggle for me, is getting people to buy into kind of new strategies that I'm trying to implement in a practice.
I agree. I think the struggle comes from what they've been told from 100 different people. I think maybe
Very
that's
few.
my biggest struggle with the athletes is that, well, Jimmy said this about my knee. Well, Todd said this about
Oh
my knee, and
Lord.
this is how we have to fix it. And so
Every day.
that I think is a huge struggle because there's also a massive miscommunication that also kind of runs parallel with my practice with my general clients is that you go to the chiro, they say this, they go to the osteo, they say this. So with athletes, if they have a core medical team, right, and they're all not on the same page, I find that very challenging because overall, you're looking at it from all different professions, which naturally should blend together based on our special tests and our assessments that we all have learned over the years. But we all have a different way of doing the assessment, which can, naturally come up with a different outcome. But I agree with you with the pressure thing. I think that is always going to be a struggle. I worked with the Toronto Arrows this season, and there are guys from.
I'm great friends with the guy that's the guy that oversees it. Chris Silverthorne is one of the
Oh,
GMs.
yes, yes.
Yeah, so Chris and I are really good friends. And I know a bunch of the guys that have been involved in that program because they're all from, crazy enough, a lot of them are from Lindsay.
Interesting. Yeah.
Yeah.
So, I mean, I learned a lot. I mean,
Cool.
I've played rugby my whole life as well, but I've learned so much more from these guys because some of them are traveling from Australia and what was it, Great Britain, Australia, New Zealand. There were a couple Toronto guys. A lot from the West Coast, sorry. Like, it was a beautiful experience, but that was one of the things is that they come in and they're these big guys and you're applying that deep tissue and that's what they feel that they need. But the thing is that when I started doing like fascial stretch therapy and I really started to open it up in a more gentle way and they could start to feel that let go, I thought that was so fascinating to re-educate them on just the ability of relaxing and breath work. I don't know if you struggle with this, but I do. I find a lot of people still hold their breath during trigger point therapy or when they're in pain, they contract or they clench their body. And breath work is something that is an ongoing challenge as well. So the first thing I always recommend is working through breath work at the beginning of their treatment, get them comfortable with that motion, and then transition into those layers of therapeutic techniques. So it's a struggle.
Yeah, but breath work, isn't that weird? For me, the breath work is weird because I was like so tuned to just focus on just, again, more weight, more stuff. And then the idea of breathing effectively and building that into your practice. As a therapist now, I love it. I'm a big Wim Hof guy.
Oh, are you? It's fabulous. Yeah.
But if someone would have told me 10 years ago, look, you're going to be doing breathing therapy, and I'm like, what? Come on.
Yes.
But that's the whole problem is that athletes, you really have to get them to buy in. And once they do, it's great. But some of them just want so much tension and pressure and more all the time. So you have to dial it back. Here's another question. How tough do you find it to coordinate your efforts with other professionals, that being chiros, physios? Do you work in a network where you have an ease to kind of work with them and build some trust in your treatment plan with those individuals, or is it kind of every man for himself?
Ooh, I think for me, if you were to ask this question to me 5 years ago in my practice, I think I would have very much gave you a different answer. But now 8 years in, I feel that I have built kind of myself up in a very humbling way, of course, to be able to vocalize my thoughts and my vision of what I see in that athlete a lot better than I maybe would have in the past, passively saying, whatever you say is correct, let's just go with the flow. I've definitely progressed in regards to my education and my own confidence, and knowing that my input matters in this healthcare kind of umbrella of a team. So if I think it also depends on who you work with. And there's no one specific I am going to choose to direct that comment at, but there are different experiences that I have had that RMTs are very well respected in the aspect of what we do and the benefits of what we can do. And then, there are other experiences I've had where we are very much low on the totem pole in regards to what our thoughts are or our suggestions for return to play. Agree. Yeah. So I think it's a little different that way, but yes.
Yeah, I've kind of went into that kind of realm and try to understand how I can best coordinate my efforts with other people. And sometimes you have to be very negotiable and put your ego aside and do all the right things. It's all good. Look, everyone's going to have their own opinions. I tell my patients, look, everyone's opinion matters. The goal ultimately is your outcome and your patient care. Whatever we have to do to coordinate our inputs or efforts or perspectives, the only goal I ever have, I told patients this morning, my goal is to get you better. And if I can't, we're going to find an avenue with other professionals as a team to get you there. I hope I don't. I don't want to have an ego that comes into my decision-making, because that doesn't serve my needs. It doesn't serve theirs for sure. Yes,
that's a big kind of struggle if we're trying to blend in athletes and our general practice together in a conversation. That is very much a big topic of this miscommunication of why people think it's a good idea to burn out someone's benefits just for their ego, to get them, as much as they can see that client and use their benefits, and there's no real outcome. And secretly, they already know that they need to go to a chiro because they need to work on that subluxation or whatever it is. And that just that drives me mad. So I agree. I think if it's an athlete or anyone in the general public, that is a true struggle. I think in some people's mindsets as therapists, I still don't understand why that's even a conversation.
I'm really lucky. The people I work with are very, I have a couple of chiros in my mix, and he just texts me, and we're going to talk about a patient today. But we have a common objective. Our common purpose is patient care. Not trying to facilitate a solution on our terms, because it never made sense to me. Here's another question, and this is one I always kind of deal with when I teach for Rock Tape. What is it about your practice dealing with athletes that really serves the general population as well? Like, what's the commonalities in that? Because some people will think you're a sports massage therapist, and I'm kind of in that realm in the sports side. How, you're so different than the normal massage therapist or the massage therapist in the clinic. I disagree with that, because my thinking is always this. I don't know about you. I see everyone as an athlete. I think that's a very purposeful statement to understand that. And I tell everybody, look, whether I had a guy from France that was home, plays pro rugby in France. In the same day, I had a guy who's 85 and he wants to golf and he had knee pain. And he said, well, it must be weird to treat me. And I said, but it's no different though.
Yeah.
My goal with you is to change your pain-free competency. Your objective is no different than his. You want to move well without pain and perform. Yes, you're at different levels in this hierarchy, but my perspective as a therapist, when I deal with that injury, I would say isn't that much different. I don't know about you.
Yeah, see, even before I started being an RMT, my biggest push was that I want to see people as people, regardless of what level or stage they are as an athlete. I think that's very important. A lot of people think it's crazy that you're working with NBA players or NHL players, but they're people. They just have different skills than you and I do. And I think that is something that I emphasize every time I meet someone, is that I don't typically get starstruck or, whatever, because I just see the body, right? Yeah. It's a body for me. It's a new adventure for me to, use my skills to the best of my abilities and help that person. That's my overall goal. And how I see people is I more so pull back and see what the history of that person is, regardless of the age, and say, okay, so if it's a golfer on a weekday golfer or whichever, then I'm looking at him through that assessment very much the same as what I would if you play hockey 7 days a week, because everyone has different biomechanics and everything that I have to assess. So if it's an athlete or if it's a general person, I see them the same way. I just do different assessments and I do different treatments. I think the most common thing that a lot of people ask me about when it comes to this question is, do the athletes get treated the exact same way with the same modality? And that is no for me. So, most times with my athletes, it's half an hour treatments. You get in there, you work those structures, you work the
100%.
compensatory structures. If they have an injury or a chronic injury, you get into there. But most of the time they're in shorts and t-shirts, or whatever is the easiest based on their injury, etc. And then the general kind of public, that style is a little bit different because I have a little bit of a niche with the general public in like fascial work. So I'm more into like neurostim and the non-aggressive treatments where you're working on the layers and actually breaking all that down. So it's actually really nice that I love that I have such a divide. Like my sports world is very much different, quick, fast pace, in and out, season's done, completed. The other side of it is, I get to spend a lot of time with my general practice and, focus and work on my skills as well to improve on those little tactics that I can actually secretly weave into the sports side as well. So it's actually a really nice blend, but I wouldn't say from my experience they're the same treatments, but I use very much the same assessment for both.
I think that's probably closer to where I am too. I mean, certainly my treatment, if I'm dealing with a pro hockey player versus, again, the general public, I have different expectations, but I think I try to reinforce for them, our goal is really common in the context of what we want to do. Mm-hmm. Certainly I use different strategies and different kind of assessments. So I really have changed in context of how I assess, and this is more rock tape and kind of the people I work with, but I'm really good at assessing through just really good movement. I become really good at just watching people move. And I say it all the time, the best assessment is just have someone move. Yes. I had a patient this morning who's had back pain for years, and so she came to me about 4 weeks ago now, and we've given her great work to do. She's really invested in the home care, and we've given her really, really powerful things to kind of complement treatment. But she walked in and I said, "How are you feeling?" She says, "Oh, it's not bad." And I said, "Wow." I watched her walk into my office and it was a completely different human being.
Isn't that the best feeling? I love that feeling.
So as she's coming towards the door, first of all, she's smiling. And when she first showed up, she was just totally demoralized by the lack of effective. She just didn't get any effect from care. And no one did anything wrong. It's just she didn't respond well. Mm-hmm. So she really, really responded well to what we've done. And when she was coming to the door today, she was like really happy. She was standing upright. So I watch posture in every human being. I'm a postural nut.
Same.
So that I literally have people just, when I interview them and they're standing in front of me just to do an intake, I literally watch their body from head to toe. Is the sacral floor level? Are the shoulders or the occiput level? And I know those are weird things, but
no, they're great
those
things.
Axes are the indication of tensional frames in the body. So I look at that. When she showed up today, this is a crazy thing. She showed up and she was like so happy. Everything's level. She's walking in like double the speed she was before. But she doesn't even know it. She's like, "Yeah, I think and I was like, "Do you have any idea the difference right now in the way that you're moving?" Even getting on the table and off the table, she was like just completely efficient. And I said, "Look,
I love those.
Movement, the best strategy for assessing human beings. We can do ortho tests all day, great. Mm-hmm. And so what does that do? It directs my treatment. But the best way to get a sense, I don't know about you, but I always do this. The best way to get a sense of how people are really responding is just have them move. Really simple archetypal stuff, like a clearance overhead. Have them squat.
That's it.
I'm afraid to squat. And I have people squat all the time. And as we get through treatment, they start squatting and they can squat down. They're like, "Hi, I couldn't do that before." And I said, "You understand that's a win. You have to tick that box."
Yes.
That's a win every
little
time.
wins. Yes.
You know what? And so I said that to the girl this morning. I said, I said, so before you have anything negative about where you are, because she's still a bit of back pain, like very localized. Yeah. I said, you need to have a checklist in your mind about where those wins are. I said, you're moving way better. You feel more comfortable. You seem way more confident about moving. And then she said, oh, I forgot. I went golfing the other day and walked 18 holes. And I'm like, how do you forget stuff like that? That's the checkbox, dude. Check that off every time, right? So I've really become, I think, really more intuitive about assessing movement. And I've told Mark and Amanda this, I came from a biomechanics background. So I did my grad work in Tennessee. I was a professor at East Tennessee State. So I was very much in this like hardware, dot the I's, cross the T's environment. Yeah. And now I'm using more of that biomechanics more intuitively just to watch how someone moves and get a sense of success treatment-wise based on really how they move and how whether they're apprehensive about human movement.
Yeah, and honestly, no, it does. And it really does, because it excites me that someone else can relate to that, because I appreciate that. Because when I work with a sports team, I am there early for practices because I want to see their warm-ups, I want to see their movement. Like when I'm specializing in a certain team, I want to see how they warm up. What's their typical, are they more of a lateral movement? Are they up and down? What's the impact on those joints over time? And then I add that into how they come into the assessment. And they say, well, do you want me to go for a walk? No, I've been watching you, right? I've been watching how you sit, what position you get up in. Like, those are very huge little cues for me that even their shoes, I have this thing at Maccabiah this is my third year with them traveling, and my athletes, they joke now, they give me their shoes. And they're like, just look at the bottom of my shoe, because the bottom of your shoe can really show if it's deteriorated over time and see kind of where your pattern is. And, it obviously, it helps with the hips and the knee tracking. And it's fascinating that people just give me their shoes now. They're like, just look, where am I at? Do I need a new pair, etc.? Because it's exhilarating when someone else can relate to this conversation, because I think that a lot of therapists just read the health history, they read whatever they put on there, and they get them right on the table. And there's so much to be said if you actually look at the actual structure of the person. And once you start cueing those things or having them recreate that movement that could have caused that injury, or for an athlete, like with my hockey athlete, for example, he's having a really hard time with lateral movement, but it's simple just cueing of that glute min that he wasn't doing. So it's just little things based on a postural assessment that takes maybe 5-6 minutes to do. So it is fascinating to have those breakthroughs by a simple assessment. It really is.
I have to connect you. So someone that teaches with rock tape, Courtney Conley, has a company called Gait Happens.
Okay.
He is a foot guru.
Is she?
I'm not. So I have to tell you this. So I'm not as much in that side. I do assessments of feet. So with rock tape, we used to go to Mexico as a group, and she would have us.
I just got back from Mexico.
Yeah, so it was awesome. At that time, it was fantastic. So she would have people walk on the pool surface after they got out of the pool, and she could figure out all their feet and their potential issues just by looking at the imprint. And I'd be like, what in the hell? What a skill set that is, right?
Yes.
So
it's great.
It's so good. And that the other thing that I think is essential, and this is why this conference is so significant, and we didn't talk much about this. I'll just mention I'm going to teach a thing on taping, just basically a 2-hour in-service on how to integrate kinesiology tape into your massage therapy practice. And the goal, I've been teaching rock tape for, almost 12 years. The goal for me with therapists, especially massage therapists, is to demystify this. Because everyone thinks taking tape and you're stabilizing, holding. No.
Oh God, the word stabilizing in tape.
Stop.
No.
Like if anyone honestly believes that you can take a piece of tape and put a joint in some place it's supposed to be is asinine. It doesn't make sense. So the point of that, all the teaching, especially with the massage therapy conference, I've taught for years with these guys, and I love being at the conference because massage therapists, more than any other group of professionals, to be quite honest, are really receptive to stuff.
Yes, they're so open.
They just
Yes.
are like, okay, give me more stuff. And I'm not saying that the other professions aren't. I teach everybody, chiros and business. But massage therapists seem to have this kind of perspective. I want to kind of broaden my scope of practice and see things.
Why not?
So with the tape thing, I'm going to basically explain, how do you demystify the tape applications? What does it actually do? And in most cases, you need to see it through a neurosensory lens. Taping is really using the skin and fascia as a conduit for the brain. That's
Beautiful.
it.
Yes.
So all you're trying to do is upregulate some of the input by extension, feed output. It's a very synergistic loop, right? Simple. And then the second one I'm doing is floss, and those are floss bands. And so
I want to do that so bad.
You've got to do it. The floss band thing. So I'll tell you the story quick. So when I was at Ottawa, I was a strength coach in the 80s at Ottawa U, and all these Russian athletes would come in and they'd be like wrapping rubber like bicycle tubes on their legs and stuff.
Yes.
And we're all like, these guys are freaks. What is going on? So this for years. So now I'm with Rock Tape, and then like 7 years ago they come out with Floss. Kelly Starrett built this whole thing. So Floss comes out, and now those guys were way ahead of their time. The science behind floss application is crazy. Some of the issues just with regards to blood flow restriction, changing fascial glide by pinning those tissues and gliding. The idea of hyperperfusion of blood and oxygen into tissue so it's less fibrous. So I in-service the Leafs and the Senators, and all of them were shown how to use floss just to improve ankle. And I'm going to tell you, Lindsay, you can put floss on the ankle. I have guys right now, all my patients have floss in their toolkits.
Yeah?
And they all floss their ankles. You can alter primary mechanisms of dorsiflexion, plantar flexion, range of motion, and comfort in those ranges 2 minutes with floss.
What? Oh, okay. I gotta go to this one. Flossing is something I've admired. When we were at the games last summer, it was Portugal and Italy. They were using it. And I was like a sponge. I was just watching them like, what are you doing? And it's the weirdest looking thing.
Okay,
but
so if we teach at the same time, I'm going to do a bunch of demos on the Friday. Mark and Man and they asked if we would do some demos. And I was like, I love doing those demos. I'll do some demos, but honestly, we'll connect at the conference and I'll show you everything. Because as a sport performance therapist, I'm going to tell you that floss bands will literally just add a tool to your toolbox that will just give you a leg up. And I'm not saying it because I work for the company. I'm super passionate about it.
Yeah.
I love the idea of a tool that I can use and my athletes can use. I gave it to an 80-year-old woman today.
Yeah.
Floss her ankles, and she's like, this is the craziest tool ever.
Well, I do have some volleyball and hockey have massive ankle issues. So I would love that in my toolkit, actually. That's good. That's exciting. It's I think I'm at 4:30 and I'm going to be blending in, it's called Kneading, Balance, and Sports, which is my company name, because it's with a K because it's my favorite technique. And it's just trying to, blend really all my professions that I've kind of learned over the 8 years and how I use those to, get to my success in sports. And, the number one question when I was a teacher for 2 years and I was teaching massage, the number one question that I always got was like, how do you do both? How do you live in both worlds and be able to have your own practice and be successful in the sports world and, still be able to have a general life? So, my little quick half an hour talk is actually going to be talking about that and how, the different milestones that I was gratefully able to hit and the connections that I built and, what's happening right now, which is so exciting. So I think we have some solid talks coming.
Yeah, I think the challenge with this, and I tell everybody to go, everybody I know who's a therapist, all my chiros, I say, you got to go to this conference. And again, it's not because I'm invested in this conference. First of all, the people that are kind of overseeing it are the best people.
Oh my God, they're my favorite people.
I know. So I was just in Halifax to teach with them, and I came home and I said to my wife, this is the group of people I want to be with. Aww. Because they see things in a way that is really, again, about great education and great and promotion of our profession.
Yes.
We, in the broader sense, exactly what you said, I think there's still this sense, it's just massage. And if you really
Forever.
understand what you do professionally, really good therapists can make a huge difference in someone's quality of life, their pain ratings, all those things that matter.
All of
So
it.
the reason I'm so invested in this conference and these people is because, number one, they're great people. But even more importantly, I really believe philosophically they see it my way, our way. They really want to promote massage therapy as a profession and educate great therapists. And that's why this conference is so significant. I can't wait because look at it this way. I love teaching, but the goal for me is to go in and teach I've got 2 2-hour sessions, but just to hang out and go to other sessions, because invariably I'll come home. My wife's a massage therapist too, and she'll come home, we'll come home.
Wow.
We'll be like, what? There were so many amazing things. It's almost impossible to get everything that you want to get. And so the value of this conference, and again, even Mark and Amanda and Scott and Monica have done a wonderful job with Massage Therapy Media. I think it's an amazing platform because it's really about promoting great education to therapists.
It's easy. It's so easy to use. That's what I appreciate too, because there's some that are so complex. But no, they're amazing. I mean, it's always a good conference. I'm so excited. I was looking this morning at all the different speakers and their little bios, and it's going to be fun. I'm excited to meet all the people.
You will. It's going to be so good. I love it. It's great. So here's the last question, and I always ask this of other therapists I work with. So what do you think the biggest deficiency is in our profession? Where do we fall short?
Deficiency in our profession.
Or what could we do better?
I think the number one thing we can do better is promote. To be honest,
you answered it exactly the way I would answer. Because I think we're all really good at what we do. I think there's some great therapists, and we're all very invested. Yeah. But again, I think you're right. Promotion, right? Promotion.
I think it is.
We do. It's
selling ourselves not short. I think that's the biggest thing. I think a lot of people, unfortunately, still have this massive misconception of what massage is and really what can be brought to the table. And I think if people just push themselves a little bit more to promote what was possible in their treatments, or just as an overall healthcare professional, not a service, but a healthcare professional treatment, then I think that we would really be heard. I think we would make a heck of a difference in regards to that, for sure.
Yeah, I think our goal needs to be to change the broader perspective about what massage therapy actually is as a healthcare option versus what their perception is as some kind of fluffy
service
kind of approach to whatever. I think that's really, really important. So look,
I'm excited.
Crazy. This was like 45 minutes. This is so good. Look, number one, you and I have to connect when we're at the conference.
Oh, I would love to.
We are very like-minded in our approach. And I love working with people who kind of see it through the lens I see it through. So I'm really excited for us to meet in person.
Yes.
And I'm super excited about the conference. I know that, again, I can't speak more highly than I possibly ever could about a conference, because I think this is one that really services therapists effectively, and they're going to get great education. So
and connection.
Get there, and this has been awesome.
Don't forget the connections. The connections are the important part about these conferences.
Absolutely.
You get to meet some really cool people, and I'm excited too. Heck yes, let the conference begin.
That's awesome. Hey, this has been a pleasure. It was really nice meeting you.
You too.
Okay. Thanks, guys.